Hello and welcome to our monthly ISCOS podcast. I'm Professor Michael Fehlings from the University of Toronto, and I'm editor-in-chief of Spinal Cord, which is a flagship journal of the International Spinal Cord Society. Each month, as part of this podcast series, we feature an article in Spinal Cord that I feel is timely or very important to highlight. And this month, we're featuring an article entitled Trends in the Supply of Spinal Cord Injury Medicine Physicians in the United States, an Existing Human Resource Shortfall. And I'm pleased to be joined on this podcast by the first author of this paper, Dr. Jason Silvestri, who's a clinical research fellow at the Medical University of South Carolina in the Department of Orthopedic Surgery, and by the senior author, Dr. Robert Ravinsky, who's an associate professor of orthopedic surgery at the Medical University of South Carolina. So gentlemen, thank you for joining this podcast and discussing our paper. And by way of acknowledgement, I also have to indicate that I am a co-author on this paper for full disclosure. Very proud of that. So perhaps, Jason, I'll start with you. And can you perhaps briefly summarize the key points from this paper?
Yeah, I think really the genesis of this paper was, as you know, spinal cord injury is increasingly a multidisciplinary effort, especially here at MUSC. We've sort of see the complexity of these patients, and we've collaborated with some of the other co-authors who aren't with us, who are physiatrists. And we wanted to look specifically at spinal cord injury medicine and to see what were the trends in sort of nationally in the US, what was the pipeline of these needed specialists, right? And I think the three main conclusions from the paper can be summarized as the following. I think there's been over the past sort of decade, a consistent growth in the training capacity for spinal cord injury medicine. It is a fellowship or a subset of primarily for physical medicine and rehabilitation, although it is a multidisciplinary fellowship. There's been a constant growth of programs and training positions. However, secondly, there's been a somewhat not consistent increase in the number of applicants. So depending on the year, the sort of rate of unfilled training positions would range somewhere between 35 to 50%. Like overall, from the study period, it was around 40%. And I think really what we wanted to discuss, today and through the paper was sort of the need to bring greater awareness to this need, right? As you know, as you pointed out in prior studies, the sort of the rates or the number of patients who are suffering from spinal cord injuries increasing. Yet, as we point out in the discussion, the number of diplomates and the number of physicians that are trained in this sort of niche area of sort of healthcare is decreasing. And so really, what are the things we can be doing as a specialty society to encourage growth in this relatively nascent field of medicine? How can we expose medical students earlier in the pipeline such that they are attracted to this field of medicine? And really, I think that's sort of the crux of the paper.
Thank you. That's an excellent summary, and certainly the paper is very topical. Dr. Ravinsky, Rob, perhaps I might ask you as the senior author on this paper to give your perspectives.
Yeah, I think that Dr. Silvestri summarized that very nicely. My perspective is the following, and I suspect it's somewhat similar to your own. With Dr. Fehlings, I mean, you are one of the foremost researchers in the world on spinal cord injury, and apart from being very familiar with the literature, I'm sure that you yourself have seen in recent years that the number of spinal cord injuries that we are seeing clinically, at Toronto Western Hospital, and likewise at large tertiary care centers like our own in South Carolina, are increasing significantly. It's not necessarily younger people with high energy injuries, but certainly the rate of central cord injuries is going up. And I think we are also increasingly recognizing that the surgical care or the possible surgical care these patients experience at their initial sort of presentation to hospital is really a small part of the complexity of their long-term care. We as surgeons are very heavily reliant on our spinal cord injury medicine colleagues in our center that is the PM&R inpatient service, and then the rehabilitation service at our rehab facility, which is our sort of the counterpart to our big house per se. These patients have incredibly complex medical and even psychosocial needs, and they really do require a very nuanced, very holistic, multidisciplinary approach to receive sort of optimal care in the long term, even outside of the initial period of treatment, 6 months down the road, 1 year, 2 years, 3 years down the road. If you look at some of the data that exists regarding the costs of care in patients with spinal cord injuries, the costs of care are significant on an annual basis for years after their initial presentation. And the reason being that they do have such complex and nuanced medical needs. So I do fear that that we are at a place where we really are lacking in some of the human resource manpower, if you will, to provide the care these patients certainly require.
Yeah, I think this paper is extremely timely, and I want to thank both of you for driving this research forward. It is interesting, to reflect on the fact that despite very successful prevention efforts, which have reduced the incidence of workplace injuries and high velocity injuries such as road traffic accidents, there's reductions in drunk driving, and so on and so forth, paradoxically, the incidence of traumatic spinal cord injury has remained stable and might actually be slightly increasing. And certainly, I think an evolving trend that we see is this entity that we have now referred to as non-traumatic spinal cord injury. And Rob, I wonder if you could maybe just reflect on this in your own practice, how you're kind of seeing this issue of non-traumatic spinal cord injury, maybe your own reflections on what this means and why this is an important area.
Absolutely. I mean, this is, even though I work at a level 1 trauma center and it's the kind of the big referral center for the region, I see far more of the non-traumatic spinal cord injury that you're describing than I do the high energy road traffic accidents, workplace accidents variety, frankly. Most of the patients with spinal cord injuries that we see are people with pre-existing spondylosis who are experiencing really low energy traumas, ground level falls. Sometimes they have undiagnosed or very mild myelopathic issues that were present at baseline that can come out later on in the history when you're kind of getting into the weeds with the patient. And a lot of these patients do have very good clinical outcomes. They do seem to make neurological improvements, but there is also the odd patient who comes in with a very profound deficit. And these typically tend to be the patients who have long-term neurological dysfunction. And this is really the subgroup that I think benefits from a long-term multidisciplinary care. Just to go beyond that a little bit, we are experiencing lots of additional strains that were not present 5, 10, 15 years ago in the American healthcare system, where there are increasing costs of care, increasing challenges regarding access to timely care, and certainly in this type of changing landscape, having a deficiency in terms of the number of experts who are providing this type of very important and extremely nuanced long-term care is concerning, to say the least.
Yeah, thank you. what what's interesting to note is that the spinal cord injury, of course, is a global phenomenon, and the incidence of spinal cord injury is higher in middle and low income countries than it is in highly resourced countries such as the United States and Canada. But despite that, what this article highlights is that even in highly resourced countries, there's likely a gap in terms of the number of specialist physicians with training in spinal cord injury medicine and the number of people that would benefit from this type of care. So that's really quite, an interesting perspective, and I think it speaks to issues related to equity in healthcare delivery as well. So Jason, you're getting near the conclusion of your training, but you're probably closer, I guess, to medical school training than Rob and certainly myself. How do you think that we could perhaps reach out to younger physicians in training and specialists in training to bring to light perhaps the opportunity to consider specialization in the area of spinal cord injury medicine?
Yeah. So really the crux of the discussion kind of highlights two or maybe three sort of key takeaways. I think at least graduate medical education and American education from the 60s is sort of still largely stagnant over the past 50 years, right? You have your core organ-based learning curriculum, cardiology, gastroenterology, nephrology, pulmonology, etc. But over the past sort of 10, 20 years, you have seen a lot of these newer subspecialties, even physical medicine and rehabilitation in the US is a relatively recently boarded, and even spinal cord injury medicine is a sort of recently recognized subspecialty within that over the past, sort of 20 years. And so I think there's a real need to bring musculoskeletal medicine, physiatry, physical medicine, rehabilitation, get sort of medical schools integrating this into their curricula earlier in the pipeline, right? I think there's a lot of literature showing that you can pique interest and increase exposure during those early kind of what I call vulnerable or susceptible areas, right? We've all can think of a really influential mentor that we've had early in our career that's helped shape us. And I think if, subspecialty societies and PMR are able to sort of coordinate those, working with different student interest groups, providing scholarships, networking opportunities, travel grants for medical students to engage earlier in the specialty, I think is an important work moving forward. Secondly, I think once you get sort of physicians in PM&R, in the pipeline, I think there's a need for longitudinal mentorship for physical medicine and rehabilitation doctors to be exposed to spinal cord injury medicine earlier in their training as well. Within the 4 years, the first 2-3 years, getting earlier exposure to this complex patient population. And then lastly, I think there's a need to sort of maintain through physician advocacy efforts sort of the attractiveness of spinal cord injury medicine as a subspecialty. Because as we're seeing here in the US, there's a constant sort of financial disincentive to at times pursue additional subspecialty levels of training. And so, imagine a recent graduate is presented with two opportunities: remain a generalist with higher financial compensation, or, receive further clinical subspecialty training for somewhat commensurate or even less, financial opportunities. I think that's presents a oftentimes an opportunity cost that's too high. And so, through physician advocacy efforts and working with, the regulatory body, CMS, et cetera, I think we need to preserve sort of the financial rate of return for, this important resource that is being provided here in the States and elsewhere. So I think that's really the sort of the crux.
Yeah, thank you. So very eloquently stated. So perhaps I'll just make a few a summary comments then in closing. So in summary, we've been discussing an article which has recently come out in Spinal Cord entitled Trends in the Supply of Spinal Cord Injury Medicine of Physicians in the United States and Evolving Human Resource Shortfall. And we've been joined by the first author, Dr. Jason Silvestri, and by the senior author, Dr. Robert Ravinsky from Medical University of South Carolina. And in essence, this article has summarized the fact that the incidence of a spinal cord injury, both in traumatic and non-traumatic forms, is actually rising in highly resourced countries such as the United States. And this has been recognized in the fact that the number of training physicians has increased, but paradoxically, the number of physicians who are undertaking this type of subspecialty training has not increased. And as a result, there's an evolving shortfall from a human resource perspective. And this is concerning in that the U.S., of course, is a highly resourced country, and one might imagine that such shortfalls would be even greater in middle and lower income countries. And I think this article serves a great service to the field by highlighting an area, and it presents many opportunities for further discussion and knowledge translation. And from a personal perspective, as editor-in-chief of Spinal Cord, I felt that this article was very important to highlight in this podcast, and in an effort to pursue this knowledge translation, there will be the opportunity to disseminate this podcast further. So on that note, I'm going to close this podcast. Rob and Jason, thank you so much for taking a few minutes out of your busy clinical days to discuss this very interesting article, and in particular, thank you very much for putting this article together, which I feel represents an important contribution to the field.
Professor Fehlings, we just want to just thank you for your gracious invitation to have us, and it's such a privilege and a pleasure, and it's great to see you again. So thank you so much.
You're welcome.